All right, hi there, J.R. Lewis with you on KLAM and KCDV, or perhaps on the YouTube channel if you're catching us there. It's Monday, July 27th, and we haven't needed one of these daily briefings for a little while. Things have been going smooth, but now not quite as smooth. So we're going to talk about some new case discoveries with Dr. Sanders on this edition of the program and get some other information on a frequently asked question about what's going on statewide and how our doctors think that we should respond to all of this news. This comes to you, these briefings come to you in the 1 p.m., 5 p.m., and 8 p.m. hours on the radio. They get uploaded, that is, to youtube.com/Cordova TV, so they can be heard online. With that, let's visit with Dr. Sanders here on the Daily Briefing. Dr. Sanders, the news we never like to talk about is the discovery of positive cases in Cordova. So let's begin with what you know about this one found most recently.
Well, we have a new case with somebody that doesn't have any recent travel history, so that is concerning for community spread. We know that around the 4th of July weekend, we identified a few community cases here. We know that coronavirus has been in our midst, and this confirms that it is still here, and we need everybody living with an abundance of caution.
Okay, so community spread means then presumably passed from somebody in Cordova to another person in Cordova. Is that sort of the basic definition of it?
Yeah, that's the basic definition, is that we have somebody without a recent travel history or a recent known exposure somewhere else. We're not sure where this came from. It is an individual that's a part of our community and now has tested positive. Okay.
You know, and you've referred a number of times to our dashboard on the city's COVID website, is because it's confusing sometimes to try to, and you'll see this on social media where people will say, wait, they're reporting a case from the Valdez-Cordova census area. Is that us? When is it? When was it? Is it the one that happened, and this reporting is all sort of, it's not like a box score, something that happens in real time, and particularly in terms of the state. But our dashboard is pretty much always as current as can be.
So, yeah, I think there's a few important things to address there. One is our dashboard. We are there were some technical difficulties for a bit, and I think that we have those ironed out. We're keeping that updated. It gets updated at least daily in terms of getting the numbers to be accurate to the community. I think that's a good place to go look for information. Other places that people are getting information, including social media, it's hard to always get that date or timestamp and understand when something's reported when you're just looking at it based on the press releases. We're trying to include total numbers in our press releases and provide as much information as we can while also respecting people's privacy. But that Cordova dashboard is the place. Sometimes it's hard to keep the dashboard in line with the state's numbers. The state has many communities, of course, that they're reporting on and a lot of data that they're trying to integrate. So sometimes their data is behind our data. The most up-to-date spot is our community dashboard.
Yeah, I was going to say, so that's the key thing. If you see differences, then tend to consider the Cordova dashboard the most current and the most accurate because it's the one that focused solely on Cordova. And in fact, the news release that came out yesterday about this massive balloon in cases statewide, like 240 of them or something they found, said that part of why that number is so big is they've been entering a backlog of cases, and so it isn't that they necessarily, that there was that big a bloom in new infections, but there was old data from a while back that's now just finally getting into the state statistics. So, I mean, it's timely you would bring up this part about our dashboard because of that very situation. And then there's the confusion about the Cordova Valdez census area, which includes us and Valdez and Whittier and Glen Allen, and I mean, there's like 24 communities, right? Something like that.
Yeah. So I think the take-home message is Cordova is. The medical team is working together, whether a case is identified at the Elanca Health Clinic or at the hospital. We are working together to make sure that we combine our information. We're getting press releases out, and the dashboard has the most up-to-date local information. In addition, I think it's important for people to know we are monitoring this not on a once a week, not on a once a day. We are constantly monitoring the risk to the community. And if we feel that there's an increased risk, we are pushing that information out. So people might see that on some of our press releases, we say this is identified community spread. We want people to be cautious. That's about as much information as we can give to tell people, hey, coronavirus is here in our community. We're asking you to be cautious and wear your mask and limit your contact with non-household members. We can't provide any more personalized information. In addition, we probably aren't going to provide any increased information on whether it was a travel or when somebody arrived. We just need everybody to know that the coronavirus is here. We're really working to protect patients' individual privacy, and we're monitoring the risk constantly, trying to help keep the community safe.
Well, and good point I think that we've talked about before too is that because some people get up in arms about, who's got it? So how can I avoid them? Because they're a risk to my health and safety and life, liberty, and pursuit of happiness. And the fact is that anybody out there can have it at any time. And if you knew, say for example, that Adam has the virus because you heard about it on social media, you see Adam in the grocery store and you go, oh, well, there's Adam. I'm going to give Adam a wide berth. And you swing right into the path of somebody that you have no idea has it, and you get within 6 feet of them or whatever, and you end up catching it from, somebody that you have no idea. The ultimate goal, whether you know somebody has it or not, is to avoid people that are not in your household, right? I mean, it really doesn't matter.
I think, and part of that goal is to really consider that, anybody, you could catch it from anywhere. But the other question that I like to ask people is this shift of, if you found out that you tested positive and you were to think about your last 48 or 72 hours worth of activity, how many regrets would you have in terms of your contacts and who you've exposed? And really start behaving in a way that thinks about how our individual choices are maybe putting other people at risk, and just working to protect each other in that way. I really want people to take a minute and think, who have I been in contact with in the last 48 hours and entered their bubble that I maybe didn't need to?
Yeah. Well, or like I've said ad nauseum, I just basically, if I ever go out, I assume everybody out there potentially has it. And not, you don't get mentally hateful toward other people as a result of that, but you just respond accordingly. Anybody could be a source of it. And so distance, masks, cleaning surfaces, all that sort of stuff. You mentioned the contact tracing, and a question came up. I think you and I both saw it on one of the local Cordova Facebook pages about the demographic information, where people were concerned that, why am I being asked about if I have insurance, or why am I being asked about my income level or that sort of stuff? What is the relevance of that, by the way, to the best of your knowledge?
Yeah, so let's talk about contact tracing. I think a lot of that the nurses are just asking the basic demographic information. One of it for collecting statistics. The other is to help guide people. If you know somebody underinsured or doesn't have insurance, we can try to help tie them in with resources where maybe they can get some assistance or get their Medicaid applications. And the other thing with contact tracing is the state is blowing up with cases. The contact tracers in the state in some communities are slightly delayed. Our community still has intact contact tracing, and we are still working with the state to have them do the contact tracing. However, to expedite that process, as we have patients with cases here in Cordova, the local team is starting to help assist with that contact notification. It's not the formalized tracing, but we're doing contact notification to make sure that people are quickly aware that they could be at risk and they are quarantining. What does that mean? If you are a close contact, so close contact means within 6 feet of somebody that tests positive for COVID-19, within 48 hours of them finding out that they're positive, or if they're asymptomatic, or within 48 hours of them developing symptoms, you're within 6 feet for 15 minutes, you're considered a contact. Those contacts are asked to self-isolate for 14 days. And that 14 days is from the time that they're no longer in contact with the original positive case. So I don't want people getting too hung up on the dates and the times. Ask medical providers for help, but what we really want is that initial, if people know that were in close contact with somebody that tests positive, we want them to self-isolate for 14 days. And during that self-isolation, they can call, make a televisit with their provider, call us for information, and we can help guide their time and let them know. Make sure that they are getting contacted by one of the contact tracers and then arrange testing. We don't want testing completed right away in that first few days from their contact. We ideally get the testing completed 7 to 10 days after they have contact with somebody.
Okay. So again, on the demographic information, there are probably statisticians who will want, as the legacy of this is recorded, they'll want to see if it affected different income groups differently, insured versus uninsured, the different races. I'm not sure what the questions are, but then the other point that you said is if they are asking if someone has insurance, it can be that if the person says no, then whoever the contact tracer is may be able to point them to resources in case they end up becoming symptomatic and needing treatment. Then, did I hear you right?
Yes, exactly.
Okay. Maybe finally here, this it's a little hard to. I'm thinking about yesterday's statewide report, which was a whopper by Alaska standards, 240 cases identified, and not just the big. I mean, they've had the problems in, I think, a Seward seafood plant, but the majority of them, I think, 185 were resident. Do you think that is within the realm of what the state, Doctors Inc. and Commissioner Crum expected, or do you get any sense from your communication with them like this is a little more viral, if I may say that, than anticipated?
I think that doctors across the state are feeling like we really need to flatten the curve again and are really wanting to push everybody to help us flatten the curve by decreasing their bubbles and only interacting with household members. So how we go about doing that is going to be different for every community, and the risk is a little bit different in each community. But I think statewide, all of us are feeling nervous seeing the numbers climb as they are, because when you see numbers start to climb, you start seeing the negative impacts from this illness a week or two later. Symptoms don't start aggressively in the beginning. It takes time for them to develop. And so I think physicians are bracing for how that's going to develop and what it's going to look like.
Okay, so, we can't control what people do around the state. We can limit our exposure to other communities in the state, obviously. If you don't have to go to Anchorage, maybe it's not a great idea because of the potential for, A, catching it, and B, bringing it back with you. But, let's have our finale be, what is your advice as one of our community doctors to people who want to make sure that they stay safe?
So it's the same advice that we've been giving. Wear your mask, use curbside services when you can, get outside on sunny days, but only with your own individual household bubbles. Enjoy the sunshine, take vitamin D, and take good care of your health.
Okay, well, that's good advice for most times of year, minus not being able to hang out with each other, but I sure appreciate your time and expertise as always, and we'll see how things evolve over the next day.
Thanks, JR.
All right, that'll wrap up today's daily briefing on KLAM and KCDV for Monday, July 27th on the radio in the 1 p.m., 5 p.m., and 8 p.m. hours, and then also uploaded to youtube.com/Cordova TV as soon as possible. Remember, the website with the dashboard that has the best information for Cordovans to be able to get an idea of what's going on in Cordova. That's COVID-19.cityofcordova.net. You also have the two phone numbers, 424-INFO. That's a city-run line where you can talk to somebody with questions or comments. And you've got the recorded line at 424-WELL, provided by the Village of Eac. We will continue to provide you daily briefings as needed here, and we hope they're of value to you, and we wish you all the best. From 6 feet apart, back to the music now on the Clam and the Eagle.